Hey guys, how you doing? Darren here, the COPD guy. Hope you're doing well. On the last video that we were looking at, we were talking about the differences between chronic bronchitis and emphysema. And on this video, we're going to talk about the 4 stages of COPD. There's mild, moderate, severe, and very severe. In the mild category, symptoms would include a chronic cough, which remember, it's considered chronic if you have a cough that's 3 months over a 2-year period. And mucus, but it's not always apparent, not always coughing mucus, but there's mucus sometimes that when you cough. And you have slight airflow limitations. You might feel slightly shortly out of breath if you climb a stair or something like that, or it takes you a little bit longer to recover than it might have in the past. So that would be mild. In that case, with mild, you just want to avoid smoking. Number one thing is you got to avoid smoking. Make sure if you're diagnosed with COPD, that should be the first thing that you do, because it's the biggest thing that you can do that can help your management. Make sure you're getting your vaccinations, your pneumococcal and your pneumonia and your whatever it is. I can't think of the other vaccine right now. But anyways, make sure you're using bronchodilators. If you're already prescribed for bronchodilators, make sure you're using your bronchodilators. And then if you had a pulmonary function test, your FEV1 or forced expiratory volume over 1 second should be equal to or greater than about 80% of your predicted value. And that would put you in the green zone, meaning that your breathing is still very effective. Continue on doing what you're doing. Just try to eliminate some of your factors. Then there's moderate COPD. Symptoms include shortness of breath on exertion and the progression of symptoms. So it gets worse and worse over a period of time. So what you'll see is maybe now you're starting to get exerted when you start to walk out to your mailbox and walk back. Maybe you're a little more short of breath than you were in the past. Management would include medication optimization, including using long-acting bronchodilators, pulmonary rehab, continue to avoid your risk factors, and you may at this time either go on either a BiPAP device or a non-invasive ventilator therapy device. That's in your moderate stages or in moderate stages. You may at that time also have to go on oxygen. Sometime around, usually in your stage 2 to stage 3 is when you're introduced to oxygen. If you were to do a pulmonary function test in your stage 2, your FEV1 or forced expiratory volume over 1 second would fall somewhere between 50 and 79% of predicted, which is considered a yellow zone. Be careful, if we fall below 50, things can get very severe. The third stage is severe COPD. Symptoms of severe COPD is increased breathlessness, frequent exacerbations, and reduced exercise capacity. When I say exacerbation, that means something has triggered you. It could be environmental, it could be weather, it could be chemicals from cleaning your home, but something triggered you and it affected your breathing to get worse and worse and worse and caused you to become breathless. That's an exacerbation. As you have increased exacerbations, that's a sign that your COPD is also worsening or moving on in that stage, or even possibly progressing to another stage. Management at this time is going to be a combination of inhaled corticosteroids and bronchodilators, oxygen therapy as needed, routine follow-ups with your healthcare team, and make sure you try to manage your exacerbations. Stay away from your known triggers. If you were to do a pulmonary function test in your stage 3, Your FEV1 would be between 30 and 49% of predicted value, and that's considered a red zone. And that if it falls below 30%, that's pretty much respiratory failure. So at this point, we need you to stay in the house or stay away from whatever is triggering you. If you need to, seek medical attention. And then stage 4 is very severe COPD. Severe breathlessness, severely reduced quality of life, life-threatening exacerbations. Now we're talking about an exacerbation where your breathing becomes so difficult and so shallow that you basically fall asleep. You become very lethargic. You become confused. And now your CO2 is rising at an exponential rate. So that's where it becomes life-threatening. If it gets too high, you go to sleep and you die. Stage 4 COPD, you have to be very careful with your exacerbations, making sure that you try to take care of them ahead of time before they get to a real bad point. Management is advanced strategies at this point. Non-invasive ventilator therapy. Chances are your BiPAP is not going to work for you. Talk to your doctor about non-invasive ventilator therapy. Comprehensive management plan, including palliative care, may be needed at this time. And again, you're going to be on a long-term oxygen therapy. If you were to take a pulmonary function at this time, your FEV1 would be less than 30% of your predicted value, and that's considered chronic respiratory failure. And that's where you're rushed to the emergency room and you're not responding. They put a tube down into your throat and they put you on a ventilator to get your CO2 back down. After a few days, you come off of that ventilator and then you're put on either a BiPAP or a non-invasive ventilator, and then you're weaned off and sent back home. Problem is, when you get home, if you don't have the appropriate therapy, you wind up right back there with your next exacerbation. Any questions about the 4 stages of COPD? I want to thank you again. If you like this content, please make sure that you hit the like button and the subscribe button. Feel free to share it to anyone you'd like to. I hope we get as many people as possible watching this and learning from it. Thank you. Have a great day. And on our next video, we're going to talk about the 5 main causes of COPD. Have a great day.